Actual lines, please.
A200, go to Med 5 and stand by, Med 5.
Roger.
Wait, stop it!
Many of our calls involve people either with mental illness or in some sort of emotional crisis, and we really didn't have the tools to deal with it. And in doing some research, one of my lieutenants brought forward an article that dealt with crisis intervention teams and decided this was the perfect thing for us.
Hi.
Crisis Intervention Teams, or CIT, are unique collaborations between police officers and mental health professionals.
What CIT teams have done in Connecticut is create an understanding of each other's roles, what each one of them brings to the table, and how that we can work together to try to resolve incidents in the best possible outcomes.
Thank you.
The actual use of CIT is pretty simple. When a call comes in, dispatcher evaluates that call, and we've always advocated for training dispatchers and call takers for that as well. Once they identify a call that would benefit from somebody who's been CIT trained, they make sure through policy that that officer gets there. Now, here's where the really simple part is. Once the officer gets there, that officer uses all of their training, everything they've learned in the CIT training and follow-up trainings. They put that to work, but they also put to work their connections within the mental health system and knowing where to find the proper help for the proper person.
We, as police officers, are the first responders. We are the ones who are most likely to be dealing with a person who's in crisis before they are connected with services.
One of the most important aspects of CIT training is the use of de-escalation techniques in potentially volatile situations.
It really is a matter of learning to slow things down. We may not want to approach them immediately until we have their complete and full attention, and then they understand exactly what we're trying to communicate to them. Use our communication skills, active listening, reflecting ideas back to the person who's expressing them to us, whether they're based in reality or not. I think it's important to have those skills because it really reduces the amount of danger for both the person in crisis and for the police officer. So the more information and the more tools that we can give to our officers, the more effective that we're going to be and the more likely that we're going to have a safe and successful outcome for everyone involved.
In addition to de-escalation techniques, CIT training also includes information on mental health, substance use and co-occurring disorders, veterans issues and PTSD, statewide mental health systems, mental health and the law, suicide assessment and suicide by cop, and use of force options.
Sometimes despite our best efforts at de-escalation, the situation may come to the point where an officer is going to have to make the choice to use force up to and including deadly force. And officers learn some of the effects that they may encounter after a use of force or other type of traumatic incident. We learn how to take care of ourselves, take care of one another, and take care of the people that we serve.
Officers are selected for CIT training from a list of volunteers and undergo an intensive 40-hour week of training.
Police officers are required to be trained on a bunch of different subjects. And that training, which is really just orientation training, what we found is you might take a nugget out of it, but it really never changed the way you do business. It never changed your fundamental philosophy on how you approach certain things. To do that, you needed to do at least a 40-hour training, and not to mention the subjects that we wanted to cover.
We've partnered with a number of disciplines to present this training, everyone from social workers to police officers who work in the field, police trainers, police administrators. A predominant number of our instructors do carry post-police officer standards and training council credentials, so that as participants go through the training, post-certified instructors allow us to bring to the table a number of credit hours towards their triannual training certification as a police officer.
The CIT training program is a model of community collaboration, support, and education.
CIT couldn't be what it is today. It couldn't have gotten started, and it certainly couldn't have been sustained if it wasn't for the strong relationship and partnerships that have been built here in Connecticut to make this possible. We collaborated with the Connecticut Alliance to Benefit Law Enforcement. And with that collaboration, we were able to take the model and start bringing it around statewide to other organizations.
Also our partners at NAMI, National Alliance for Mental Illness, and bringing in the family piece. It's a very important component that the officers that go through the training understand the family member's perspective.
Once the Department of Mental Health and Addiction Services saw what we were doing, they saw the value in it.
And decided to vigorously pursue funding to establish this program across the state. Once the funding was secured and we established the partnership between Cable and NAMI, the program quickly took roots and spread throughout the state.
As the CIT program expanded, the challenge was to make it affordable and accessible to all Connecticut law enforcement agencies.
We do that a couple different ways. First of all, the trainings are tuition-free. The second thing we did was try to make the trainings regionally. We were able to make it more convenient to get officers there. They didn't have a lot of travel time going back and forth.
Persons from each of those regions are then brought in as part of the teaching cadre, so actual resources from each of the 5 regions are presented to the officers, and they'll know for the future that they're in their community.
The other thing that we did, one of the biggest problems was that departments are affected by the fact that when they send an officer to training, they sometimes have to pay overtime to replace that officer on the street. So what we did there is working with the Department of Mental Health and Addiction Services, identifying funding to defer those costs.
The benefits of CIT training are undeniable. Fewer injuries to officers and people in crisis. A reduction in calls for service due to improved access to mental health care. A decrease in need for costly emergency response team call-outs. And improvements in community relations.
It's allowed officers to know what they're walking into, have a better understanding of the population we serve. It's another component of our total population, as well as it has also allowed us the ability to ensure we're sending the right services. It doesn't have to be an emergency response team or a SWAT call-out necessarily.
How are you doing?
If we can identify the call ahead of time and we can get the right resources going from the beginning, we may be able to bring it down to a lower level of response.
The overarching goal of CIT training is safety. Safety for the responding officers, safety for the person in crisis, and safety for the community at large.
And so that's the simplicity of CIT. It's not a special unit. It's officers in the street that would already be out in the street handling calls. The difference is a certain percentage of your officers are trained to a higher standard in this particular field. And then you just get the right officer to the job where their skills are going to be used, and you get better outcomes. I mean, it's a no-brainer.